Rylaze 10 mg per 0.5 ml intramuscular solution is a medication used to treat certain types of cancers such as acute lymphoblastic leukemia, ALL, and lymphoblastic lymphoma, LBL. It contains the enzyme Asparaginase erwinia chrysanthemi, which works by starving tumor cells of needed nutrients and slowing tumor cell growth. It is important to take Rylaze as directed by your doctor. The dosage and frequency will depend on your medical condition and response to treatment. It is typically given as an injection into the muscle by a healthcare professional. Taking Rylaze at the same time each day can help you remember to take it. It is best to follow your doctor's instructions on when to take this medication for the best results. Be sure to discuss any concerns or questions with your doctor or pharmacist. This medication is administered by injection into a muscle as instructed by your doctor. A healthcare professional will administer the injection. The dosage and treatment schedule are determined based on your medical condition, body size, and how you respond to the treatment. Your doctor may prescribe other medications before each dose to help prevent side effects like allergic reactions or nausea. To ensure you get the most benefit from this medication, it's important not to miss any doses. To help you remember, mark the days on the calendar when you need to receive this medication. Some common side effects of Rylaze 10 mg per 0.5 ml intramuscular solution asparaginase enzyme therapy agents include pain or swelling at the injection site, nausea, vomiting, diarrhea, loss of appetite, headache, or tiredness. Your doctor may prescribe medication to prevent or relieve nausea and vomiting. Eating several small meals, not eating before treatment, or limiting activity may also help lessen some of these effects. It's important to note that this medication has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. However, it's important to tell your doctor right away if you experience any serious side effects such as stomach/abdominal pain, pain/redness/swelling of arms or legs, muscle/joint pain, yellowing eyes/skin, dark urine, unusual bleeding/bruising, or signs of high blood sugar. Additionally, this medication may lower your ability to fight infections, making you more likely to get a serious infection or make any existing infection worse. If you notice any signs of infection, such as a sore throat that doesn't go away, fever, chills, or a cough, tell your doctor right away. While a serious allergic reaction to this drug is rare, seek medical help immediately if you experience symptoms such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. It's important to remember that this is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects not listed above. If you experience any side effects, you should call your doctor for medical advice. Before starting Rylaze, it's important to let your doctor know if you have any allergies, especially to asparaginase products, or if you have a history of bleeding or blood problems, pancreatitis, or liver disease. Also, make sure to inform your healthcare professional if you have any upcoming immunizations or vaccinations scheduled, as Rylaze may affect your ability to receive live vaccines. To minimize the risk of injury, use caution when handling sharp objects and avoid activities that could result in cuts or bruises. It's also crucial to disclose all the medications and herbal products you are currently using to your doctor, especially before undergoing any surgical procedures. If you are pregnant or planning to become pregnant, it's essential to discuss this with your doctor, as Rylaze may harm an unborn baby. Your doctor may recommend a pregnancy test before starting the medication and advise the use of reliable non-hormonal birth control methods while taking Rylaze and for 3 months after the last dose. If you become pregnant while using Rylaze, it's important to consult with your doctor about the potential risks and benefits of continuing the medication. Breastfeeding while using Rylaze is not recommended, as it is unclear whether the drug passes into breast milk and may pose a risk to the infant. It's crucial to consult with your doctor before breastfeeding while taking Rylaze. It's important to note that Rylaze 10 mg per 0.5 ml intramuscular solution asparaginase enzyme therapy agents may interact with other medications, potentially affecting how they work or increasing the risk of serious side effects. This is not a complete list of possible drug interactions, so it's crucial to keep a record of all the products you use and share it with your doctor and pharmacist. It's also important to not start, stop, or change the dosage of any medicines without your doctor's approval. Additionally, this product could interfere with certain lab tests, leading to false test results. It's essential to inform lab personnel and all your doctors that you are using this medication. If you suspect an overdose and notice severe symptoms like fainting or difficulty breathing, it's crucial to seek immediate medical help. In the U.S., you can contact your local poison control center at 1-800-222-1222, while Canadian residents can reach out to their provincial poison control center. It's important to have lab and/or medical tests done while using Rylaze 10 mg per 0.5 ml intramuscular solution asparaginase enzyme therapy agents. These tests may include complete blood counts, liver function, amylase/lipase levels, and blood sugar. Make sure to keep all medical and lab appointments to monitor your health while using this medication. Make sure to take each dose of Rylaze 10 mg per 0.5 ml intramuscular solution asparaginase enzyme therapy agents as prescribed by your doctor. If you happen to miss a dose, it is important to consult with your doctor or pharmacist to establish a new dosing schedule. This medication is administered in a medical facility and is not intended for storage at home. It is important to follow the instructions of healthcare professionals regarding the administration of Rylaze 10 mg per 0.5 ml intramuscular solution asparaginase enzyme therapy agents. This medication is used to treat acute lymphoblastic leukemia and is typically given as an injection into the muscle by a healthcare provider. The dosage and frequency of administration will be determined by a healthcare professional based on individual factors such as medical history and response to treatment. It is important to follow the recommended dosage and schedule for optimal effectiveness. Consult with a healthcare provider for the best time to take this medication. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.